Somatic complaints are very important symptoms in all anxiety disorders. They are very often the first signs and symptoms that the patients present when they ask for help by their general practitioners, but also by their psychiatrists. And very often the diagnosis of an existing anxiety disorder follows the diagnosis and evaluation of the primarily presented physical symptoms or physical complaints that the patients report to their physicians. Our motivation for this meta-analysis was that we were interested in whether our clinical impression and our clinical experience that we made with Silexan in the treatment of anxiety disorder patients is just a subjective, anecdotal experience, or whether this observation can also be found in randomized controlled trials, in formally conducted scientific clinical studies. And therefore we decided to go into the data of existing studies and search for the possibility to find out whether or not there is an indication for an efficacy of Silexan on somatic complaints in anxiety disorders patients. Yeah, so we analyzed 5 studies, 5 clinical randomized controlled trials with more than 1,000 patients. That were about 1,100 patients that have been enrolled in these 5 studies that have been submitted to our meta-analysis. Results are, in a way, pretty simple. They were a confirmation of our clinical impression, namely that we found in these studies that have been conducted for a different purpose, by the way, that they confirmed that the treatment of anxiety with Silexan had also a measurable and highly significant effect on somatic complaints associated with these anxiety disorders. The significance of this meta-analysis is, among other findings, that it reassures the physician, but also the patients, that the physical complaints are also well treated by Silexan in patients with anxiety disorders. And being sure about the effects, and that these effects are not just a subjective observation, but also can also be found in formally conducted studies, as we found and reported in our paper, gives the physician, the prescriber, but also the patient, a much stronger security and a much stronger therapeutic confirmation that the treatment, Silexan, in this case, is a reasonable and efficacious treatment for the complaints, the psychological but also the physical complaints of these patients.